Cancer is one of the leading causes of death in the Philippines, according to the Department of Health and Philippine Statistics Authority. In 2020, there were 67,267 new cases reported among men and 86,484 women. Breast cancer is the highest reported cancer among women, and lung cancer is still the most common among men. Beyond the physical challenge of the disease lies an unseen agony.
When the doctor says you have cancer, it's not really cancer ang ilang madungog. It's basically the death that goes with it. And I think this is also one of the reasons why a lot of people, it took them a while before deciding to get the necessary treatment. And this is one of the challenges that the program tries to address.
The Eduardo J. Aboitiz Cancer Center was founded in 1988 after Eduardo Aboitiz passed away. Mindful of his wish to reach those who might be saved, his family sought advice and assistance from the Cebu medical practitioners since oncology was a relatively new field at that time. As a service arm of RAFI, the Eduardo J. Aboitiz Cancer Center implements programs that center on cancer education and advocacy, prevention and screening for early detection, and provides support for early diagnosed cases as well as psychosocial support to patients and family. Aligned with RAFI's thrust to help people achieve high levels of physical well-being, EJACC works with other organizations to provide a quality cancer program in the province of Cebu. RAFI EJACC, along with its partners, provides a holistic cancer care program geared towards helping those most in need in their battle with cancer.
Daghan kay silag natabang nako, ma'am, kaysa katong pagka-ospital nako. Gisuportahan ko nila sa mga tambal dayon sukad ko na diagnose hangtod karon yearly gyud ko nila nga gisuportahan sa akong laboratory.
Nalipay sad ko nga gihatagan ko sa RAFI financial para pa operasyon. Kay wala sad siguro ang RAFI, dili gyapon ko maoperahan tungod kay kulang man ang kwarta.
Upon knowing I have diagnosed breast cancer, ayoko talaga. It's because of my daughter told me nga, oh, yung dalawa mong sister, ikaw pa kaya, doon ako naglakas loob na magpagamot ako. Kaya kung hindi pa ako nagpagamot, baka maybe wala lang.
Our mission is basically to save those who can be saved. So that's basically why the program was made in the first place. Our program is designed our pattern along the continuum of cancer care. So we have a cancer advocacy and awareness program. We also do screening and diagnostic. So we provide assistance for patients for access to screening or diagnostic, especially for patients who are at high risk age. For patients who are diagnosed with an early stage of cancer, we also do provide assistance for treatment, like surgical assistance, so that patients can have themselves undergo surgery as a primary form of treatment. And then we also provide assistance for their chemotherapy and radiation requirements.
From 2019 to 2020, RAFI EJACC supported cancer screenings for 9,980 patients, provided assistance for treatments to 147 cancer patients, conducted 20 psychosocial support activities for patients and their families, and 22 LGU/RHU staff trained on how to do breast, clinical, and cervical pap smear screening. EJACC believes that early detection is critical for increasing the chances of survival. For those seeking financial assistance for cancer screenings and diagnostic tests, the requirements are as follows. For those patients who have been diagnosed with stage 2 cancer and below, you may qualify for treatment assistance. The criteria for qualified patients are as follows. For those patients who qualify, you may apply for assistance by submitting the following requirements. These qualifications for cancer patients should go before the previous segment, which are the requirements that patients would need to prepare for assistance. For inquiries, you may ask your Rural Health Unit or RHU for assistance, or you may reach us through our project officers, Gina Marikit and Karen Wenceslao. Cancer can be a difficult battle, but no one has to brave it alone. Together, we can save, give hope, and win against cancer.